How to Survive a Heart Attack Alone. After 67 life-saving tips. Every senior must know, what if I told you that within the 5 minutes it takes to read this message, 12 seniors will suffer a heart attack, and nearly half of them will be alone? I'm Dr. William Carson, and after 4 decades as a cardiologist, I've heard the heartbreaking words too many times. I just didn't know what to do. The reality is that 65% of heart attack deaths in people over 60 happen before they get to the hospital. Often, this is because crucial minutes are lost due to confusion or denial. But what if I told you that knowing just 7 specific steps could double your chances of survival? Today, I'm sharing the exact life-saving protocol that saved my patient Richard's life when he had a heart attack alone in his garden last summer. These aren't just theory, they are the exact actions that could mean the difference between life and death. Welcome back to Life Advice for Older People, where we address real challenges facing seniors today. I'm Dr. William Carson, a cardiologist specializing in geriatric heart care. Over the years, I've seen how proper knowledge can truly save lives. Heart attacks in people over 60 bring unique challenges. Symptoms might be different from what you expect. Your body reacts differently to stress. And medical professionals rarely discuss that the survival protocol when you're alone is very different from when you have help. Today, I'll guide you through the 7-step protocol I teach all my patients over 60. Why? Because when Richard, my 72-year-old patient, collapsed alone last summer, these steps saved him. Before we start, remember, this information is not a substitute for emergency medical care. It's meant to keep you alive until help arrives. Many seniors live or spend significant time alone. Knowing what to do in those critical first moments can save your life. If you find this helpful, please like and share with someone you care about. You might save a life. And if you're new here, subscribe for more senior-specific life-saving advice. Now let's dive into the 7 critical steps that can save your life if you have a heart attack alone. Tip number 1. Recognize unique warning signs in seniors. The first and most vital tip is to recognize that heart attack signs in seniors often aren't what you expect. Many grew up thinking a heart attack means clutching your chest in severe pain. But for adults over 60, especially women, symptoms can be subtle and very different. Research from the American Heart Association shows nearly 40% of seniors having a heart attack never feel the classic crushing chest pain. Instead, they experience what doctors call atypical symptoms. But for seniors, these are very typical. Let me tell you about Joyce, an 83-year-old patient who almost ignored her heart attack signs last year. Her symptoms were sudden fatigue, mild dizziness, and feeling not quite right. No chest pain at all. Luckily, her neighbor noticed and called 911 immediately. Here are the warning signs seniors must know. Sudden, unusual fatigue or weakness, different from normal tiredness. Shortness of breath, even with little activity or while resting. Unexpected cold, clammy sweating, unrelated to temperature or exercise. Nausea, indigestion, or discomfort in the upper abdomen, often mistaken for stomach issues. Lightheadedness, dizziness, or confusion. Confusion can be the first sign. Pain or discomfort outside the chest, jaw, neck, back, or arms. Sleep problems or increased fatigue days or a week before a heart attack. Women over 60 especially need to watch for fatigue, shortness of breath, and nausea. Have you ever ignored these symptoms? Let me know below. Recognizing these signs early and acting fast is your first life-saving step. Don't delay because you don't have Hollywood symptoms. Trust your instincts. Next, I'll tell you exactly what to do if you notice these signs and are alone. Tip number 2. Call 911 immediately. Don't drive yourself. This might sound obvious, but many seniors make the deadly mistake of driving themselves to the hospital. The moment you think you're having a heart attack, call emergency services immediately. Every minute counts. For every minute without treatment, more heart muscle dies. After 10 minutes, damage may become irreversible. After 30 minutes, it's often permanent. Why shouldn't you drive? First, driving diverts your focus and stresses your heart more. Second, if you lose consciousness or worsen, you risk crashing and hurting others. Third, when you call 911, treatment starts immediately. Paramedics can administer medications, CPR, and defibrillation and alert the hospital. My patient Anthony, 76, ignored this once. He drove himself but lost consciousness and crashed. Luckily, help arrived, but precious minutes were lost. If you're alone and symptoms start, stop what you're doing, sit or lie down, call 911 even if unsure. Say clearly, I'm a senior experiencing possible heart attack symptoms. Unlock your front door, and if you have a medical alert device, use it too. Calling family first causes dangerous delays. Call emergency services first. then loved ones. Have you thought about what you'd do if you had a heart attack alone? Share below. Remember, calling for help immediately isn't overreacting. It's the smartest move. Tip number 3, take aspirin correctly. Timing and dosage matter. Aspirin is a simple medicine that can be a lifesaver if taken properly during a heart attack. It helps by stopping blood clots from growing, which block blood flow to your heart. Studies show taking aspirin during a heart attack lowers death risk by up to 23%, but only if done right. My patient Sylvia, 68, took aspirin but made 2 errors. She swallowed it whole and drank a full glass of water. This slowed its effect. Here's how to take aspirin correctly if you suspect a heart attack. After calling 911, take 325 milligrams, usually 1 full-strength adult aspirin or 4 baby aspirins. Chew the aspirin thoroughly before swallowing, so it absorbs faster. Take it with a small sip of water, just enough to swallow. Tell the dispatcher and paramedics you've taken aspirin, with amount and time. If you're allergic or on blood thinners, skip aspirin unless your doctor said otherwise. Don't use acetaminophen or ibuprofen as substitutes. Keep aspirin in easy-to-reach places. Purse, bedside table, kitchen, car. Did you know about chewing aspirin during a heart attack? Let me know. Remember, aspirin doesn't replace medical care. It's a helpful step while waiting for help. Next, I'll explain how to position yourself while waiting. Tip number 4, position yourself for survival. Sitting versus lying down. Contrary to what many think, lying flat isn't always best during a heart attack. How you sit or lie can ease the heart's workload and improve oxygen flow. My patient Carlos, 77, lay flat like he saw in a movie. This worsened his breathing and heart strain. Paramedics repositioned him immediately. Here's the best positioning depending on symptoms. If short of breath, sit upright with back supported, knees bent or straight, called high Fowler's position, to help lungs expand. If dizzy or lightheaded, sit slightly reclined at a 45-degree angle with head supported, to keep blood flowing to your brain without stressing the heart. If nauseous, sit upright and turn slightly to your left to reduce risk if vomiting occurs. Avoid standing or walking while waiting. Loosen tight clothes around neck, chest, or waist to ease breathing. If cold, cover yourself with a blanket to prevent shivering, which strains your heart. Choose a place near your unlocked front door so paramedics can find you easily. If you're upstairs, don't try to go down. Call 911 and tell them where you are. Where would you wait in your home? Share below. These positions help only until help arrives, not replace treatment. Next tip is about managing pain and anxiety. Tip number 5, control your breathing. The 4-7-8 technique. During a heart attack, panic raises adrenaline, increasing heart rate and causing rapid, shallow breathing, which stresses the heart further. Controlled breathing calms your nervous system, lowers heart rate and blood pressure, and improves oxygen flow. My patient Vivian, 71, used this technique to stay calm while waiting for help. Here's how to do the 4-7-8 breathing. Sit comfortably, supported. Place the tip of your tongue behind your upper front teeth and keep it there. Exhale fully through your mouth, making a gentle whoosh sound. Close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7, or as long as comfortable. Exhale fully through your mouth for a count of 8, with the whoosh sound. Repeat at least 4 times or until help arrives. This activates your parasympathetic system, reducing panic and helping your heart. Have you tried breathing techniques during stress? Share your experience. This won't replace medical care, but can extend your survival time. Next, a controversial tip for extreme situations. Tip number 6. Self-administer chest compressions if necessary. If you begin to lose consciousness during a heart attack alone, traditional CPR is impossible on yourself, but a modified technique may help. This is controversial, but can offer some circulation when no one else is around. My patient Samuel, 74, used this when blacking out at his cabin. It gave him a fighting chance until help arrived. Here's how. If losing consciousness, lie down on a hard surface, floor preferred. Make a fist with one hand. Place knuckles in the center of your chest over the sternum. Use your other hand to push your fist forcefully down about 2 inches. Aim for about 100 compressions per minute, beat of the song Stayin' Alive. Continue until help arrives or you regain consciousness. This is risky, especially for seniors with fragile ribs, but in a life or death moment, it's worth trying. Remember, this is a last resort. Your focus should be on calling 911, taking aspirin, positioning yourself, and controlled breathing. Have you learned CPR? Do you think more seniors should? Comment below. Tip number 7, prepare in advance. Create a heart attack action plan. This final tip might be the most important. When a heart attack starts, pain, fear, and reduced brain blood flow cloud thinking. Planning ahead is crucial. My patient Louise, 79, credits her survival to having a detailed plan she regularly reviewed. When symptoms started, she followed her plan without hesitation. Here's how to create your plan. Make an emergency medical info card. Name, age, conditions, meds, allergies, emergency contacts, doctor info. Keep one in your wallet, one visible at home. Place aspirin in easy-to-reach spots like purse, bedside, kitchen, and car. Program emergency contacts in your phone with ice in case of emergency. Consider a medical alert device, especially if living alone. Mark your house number clearly for emergency responders. Practice your emergency response regularly so muscle memory takes over. Talk with family or neighbors about your plan. Arrange check-ins if alone. Update your plan every 6 months or with any health changes. Discuss with your doctor about keeping nitroglycerin at home if prescribed. Have you made a plan for yourself or loved ones? Share your thoughts or questions. Planning isn't fear, it's control that can save your life. Back to Richard's story. At 72, an active gardener living alone, he felt unusual fatigue and back pressure while working. Because we had discussed senior-specific warning signs, he recognized symptoms immediately. He stopped, called 911, chewed aspirin he kept in his pocket, sat upright, used the 4-7-8 breathing technique, and left his gate unlocked, a habit from his plan. Paramedics arrived in 12 minutes. Doctors confirmed a serious heart attack with a 95% blockage in his left anterior descending artery, the widowmaker. Thanks to his quick actions, Richard had minimal heart damage and was back gardening 6 months later with medication adjustments and a new appreciation for preparation. Richard told me, "I thought I'd know instantly if I had a heart attack, but the symptoms were nothing like I expected. Without that plan, I might have just rested and lost precious time." Richard's story is common. Many seniors survive serious heart attacks because they know what to do in those critical first moments. Now you know the 7 life-saving tips to remember if you have a heart attack alone. Recognize senior-specific symptoms. Call 911 immediately. Take aspirin correctly. Position yourself for survival. Control your breathing. Use self-compression, if absolutely necessary. Prepare your heart attack action plan in advance. If this helped you, please like and share. Subscribe for more senior-focused, life-saving advice. Tell me which tip surprised you or ask questions about your plan in the comments. Remember, knowledge and preparation are your best defenses against heart disease. Until next time, this is Dr. William Carson wishing you heart-healthy days ahead.